This is NDTV, and you're watching NDTV 24/7.
Hello and welcome to our show, Health and Wellness, Myths and Facts. I'm Gargi Rawat. Endocrine glands produce and secrete hormones that are responsible for many important body functions, and it plays a vital role in whether or not you develop diabetes, thyroid disease, growth disorders, sexual dysfunction, and a host of other hormone-related disorders. Thyroid hormones play a key role in a number of body systems, but how much do you really know about the gland that holds such a huge responsibility for your health? Thyroid disorders are the most common among all endocrine diseases in India, and according to a projection from various studies on thyroid disease, it has been estimated that about 42 million people in India suffer from thyroid disease. That's 1/3 of thyroid patients in India still remain unaware of their condition. Thyroid dysfunction can over time result in obesity, joint pain, infertility, and heart disease. The disorder affects people of all ages, and a timely diagnosis and complete treatment with the appropriate medications can ensure a successful outcome. Our experts today will provide medically accurate and actionable advice to help prevent the development of thyroid disorders and how to tackle it. To talk about this, we're joined by Dr. Rakesh Sahai, a professor and head department of endocrinology, Osmania Medical College, Hyderabad, Dr. A. Mithili, a consultant endocrinologist, Visakhapatnam, and Dr. Hamid Ashraf, associate professor and director, Rajiv Gandhi Center for Diabetes and Endocrinology, Aligarh. Thank you so much, doctors, for joining us on the program. And Dr. Sahai, I'd like to start with you. Now, despite the high prevalence, thyroid disorders, along with other non-communicable diseases, remain fairly neglected. At least that's what it seems from here. So, are thyroid problems serious?
Thank you for the question. I think, as you rightly summed it up, the thyroid disorders are not uncommon. They are probably the most common endocrine disorders. They're as prevalent as diabetes today, but they are not I think the problem about thyroid disorders is not very well understood by everybody. But the good part is that thyroid disorders are not very serious. They can be managed very easily once appropriately diagnosed and timely diagnosis done. It can be managed very easily with medication. So that's the good part of it, that thyroid disorders can be managed very easily, and they do not lead to serious consequences as long as they are identified early and treated appropriately.
All right, Dr. Mithili, hypothyroidism is a common endocrine disorder. So what exactly is this, and what are the causes for this?
Yeah, thank you, Gargi. So you've given a very wonderful introduction. And hypothyroidism is a disorder which occurs when there is a deficiency of the thyroid hormones. And this deficiency occurs when the gland is either not functioning, or the gland is absent, or the gland is destroyed. So when is the gland absent? So the gland is absent for some genetically by birth. In a newborn, the gland may be absent, and that produces hypothyroidism in the newborn. And for some, the gland is removed for some various reasons. If the gland is removed, then again there is hypothyroidism. Then the gland may be destroyed. Most commonly what we see today is an autoimmune destruction of the thyroid gland. So this is the commonest cause which we see today. And of course, the other causes where the gland is destroyed is given radiotherapy. When radiotherapy is given to head and neck for certain cancers, then the thyroid gland gets destroyed. And similarly, the gland may get destroyed when radioiodine therapy is given to the gland. And then when the gland doesn't function properly, there is a normal gland, but it is not functioning. And this previously, it was very common due to iodine deficiency. However, with iodine supplementation, we don't have this hypothyroidism very common. But then the gland doesn't function when certain drugs are also not given, like drugs that are given in depression, like lithium, then drugs used in cardiology, like amiodarone, then certain drugs used in cancer chemotherapy. So all these can produce hypothyroidism. So this is in a nutshell the common causes which can produce hypothyroidism, and by and large the most common cause what we see is an autoimmune destruction of the thyroid gland.
All right, Dr. Ashraf, what are some of the common symptoms of hypothyroidism, if you could share with us?
As we have already discussed that it's a very common kind of disease in our society, and another thing about thyroid is that its deficiency or excess can affect any part of our body from head to toe. So we can have a plethora of manifestation. It can have varied manifestation in different people. But some of the common manifestations include swelling over face, limbs, weight gain, constipation, cold intolerance, dry skin, hair loss, or anemia, that is pallor, or some patient may also complain of decreased appetite. And in women it is also very common. Commonly it can lead to irregular menstrual cycles. It can also lead to infertility and abortions. But two things are important here which I would like to make clear to our audience is that most of the hypothyroid patient which is diagnosed nowadays, they are having subclinical hypothyroidism, meaning thereby they don't have that much of symptoms, and this disease is basically diagnosed on the basis of lab results. And another thing is that weight gain is not so much in patients of hypothyroidism. Most of the time, weight gain is very modest. It can lead to up to 2 to 3 kg of weight gain in patients of hypothyroidism. If it is more than that, it means that there are some other causes of for weight gain, and most of the time this is because of diet and lifestyle issues rather than hypothyroidism.
Right, and Dr. Sahai, if you could, share what are the risk factors of hypothyroidism and why one needs to be worried and, continue to do checkups to check for it.
Yeah, so Dr. Maitri has very nicely given us the causes of all of hypothyroidism. So taking that further, we can understand who are the people who are at risk of having thyroid disorders and who are the ones who need to be screened. So, so the risk factors probably could be that those who have got a family history of thyroid disorders, if they have any other family member having thyroid disorder, then this is a risk factor for having thyroid disease. Then presence of other autoimmune diseases. Autoimmune diseases may be in the form of rheumatoid arthritis or maybe SLE and other conditions, or even type 1 diabetes is autoimmune disease. So if somebody has an autoimmune disease, then those are a risk for having thyroid dysfunction. Then other than that, living in a place where there is iodine deficiency, or even in a place where there is excess iodine intake, so that can also lead to thyroid dysfunction, hypothyroidism. Then again, another important issue is that during pregnancy and during menopause, there are significant hormonal changes, and these are a risk for development of hypothyroidism. And apart from this, people have had a radiation for any other cancer, or who have had chemotherapy for cancers, or who have had a previous neck surgery, thyroid surgery in the past, they are all at risk of having hypothyroidism. Apart from this, you could even say that crossing the age of 60 and being female also is an important risk factor for having thyroid disease. Apart from this, we can say that there could be some other conditions like, some genetic conditions like Turner syndrome and Down syndrome where thyroid dysfunction is very common. So these are all the situations where individuals who are in these situations are at higher risk of having thyroid dysfunction, and they should get screened for thyroid disease.
Right. Dr. Mithili, now we've been talking about hypothyroidism and also the fact that, it may not have noticeable symptoms in the early stages, but over time, untreated hypothyroidism can cause a number of health problems. If you could tell us more about that, which organs can be affected?
Every organ is affected in hypothyroidism, starting from the brain to the skin. So if you see a newborn, if the thyroid hormone is not there, the brain development doesn't take place. Then in a growing child, if the thyroid hormones are absent, there is a defect in the linear growth. They don't grow adequately. They are short and stunted. And so in an adult, as already pointed out by Dr. Hamid, these people go around all specialists. The complaints are so varied that they may visit the gynecologist. Women visit gynecologists for infertility and menstrual disorders, or they may become very lethargic and depressed, so they may visit the psychiatrist, or they may have severe body pains and then arthralgias. They may go to neurologists, they may go to orthopedicians. Then the skin changes. The skin changes are, the skin is so coarse and dry. So they go to dermatologist. Most important is the hair fall. So for the hair fall is a common reason why hypothyroidism is first detected. So they go to the dermatologist, and then constipation is another common problem, and they visit the gastroenterologist. So no specialty is exempted. The disorder mimics has a very varied presentation, and what all the clinicians do is when a patient presents with these complaints, the first thing that is done is to do a thyroid hormone estimation.
All right. Well, thank you so much, doctors, for telling us so much about how to check for hypothyroidism and the dangers if it's left neglected. We'll slip into a short break now and come back with a lot more. Stay with us. Welcome back to Health and Wellness, Myths versus Facts, and we're talking about thyroid dysfunction and its impact on our health, as well as what you need to watch out for. And we have a panel of doctors with us. Dr. Ashraf, what are some of the reported side effects of thyroid hormone tablets?
Yeah, it's a very important and very good question, because this is one of the most frequently asked questions in our practice. Because patients are worried if we are taking medication for so long, if there will be any side effects. So one thing would be that we should assure the patient that this drug which is given in patients with hypothyroidism, levothyroxine, it is not a drug which is being given from outside. It is a thing which is being produced inside our body by the thyroid gland, and because of some reason, as it has been discussed, that this thyroid gland is not functioning properly. In that situation, we are giving it from outside. It is used, if it is taken in a proper amount under supervision and in a proper dose. In that situation, usually does not lead to any kind of adverse events. It's a very safe kind of drug. But if there is overdosing, in that situation, definitely it can lead to problem. Like it can lead to palpitations, it can lead to decreased sleep, it can lead to weight loss also. And specifically in elderly, it can lead to weakening of the bones, it can enhance the osteoporosis, and it can also precipitate different kind of heart problems like arrhythmias, and it can also lead to heart failure in elderly if given in excess amount. So patients should check their thyroid profiles at a regular interval in consultation with their doctors, and they should be checked at more frequent intervals if there is a change in the dose of levothyroxine. But if the patient is stable on some dose and they are doing well, then it can be checked once or twice in a year. That will suffice.
Right. Dr. Sahai, when should they be advised for hypothyroidism screening, and what are the numbers that they should remember?
Yeah, so it's important to understand that thyroid disorders are very common. They can present with varied manifestations, and treatment is very good. Treatment is very effective in controlling these symptoms and getting them back to normalcy. So therefore, it's very important that we should know whom to screen for thyroid disorders or hypothyroidism. So it's very important that when a child is born, every child who is born should be screened for hypothyroidism. And that should be done between the 3rd and 5th day of life, because that's very important to understand that, because children, 1 in 1,500 children born can have a congenital hypothyroidism, and that may not manifest at birth. They may be absolutely normal at birth, and later they may manifest over the next few months. And during this time, it's very important, because the major part of the brain development happens, and if you are missing the diagnosis, then we are left with a child who is always having mental subnormality. So it's very important that we start treatment early. So it's very important that all children should be screened. Apart from that, we should screen children with type 1 diabetes, because they have very high chance of having hypothyroidism. Then women who are above the age of 60 need to be screened for hypothyroidism. The other important groups are probably those with a family history of thyroid dysfunction. They need to be screened. When you're looking at children, apart from the time when you're screening at birth, you don't need to worry later on. You need to screen them only if they are having, where they are seen to grow slower than their peers, or if they are having a delay in pubertal development, then you screen them for hypothyroidism. Apart from that, women who have frequent menstrual problems, or who are having difficulty in conception, so in these women we need to screen them for hypothyroidism. Apart from this, those who are gaining weight, who have mood disturbances, or have the typical symptoms of hypothyroidism as I mentioned, these are the ones who need to be screened. And if you want to know the numbers, to make it very simple, a TSH more than 4.5 is below that is considered to be normal. Anything above that is abnormal, and that needs to be looked at in the context of the problem. And for screening at birth, it is a little different number. You look at a number of more than 20 that should be kept in mind, but it's important that we screen and the doctor takes a call on the numbers.
All right, Dr. Maithili, what happens when thyroid blood test reports are normal? Can hypothyroidism be mistaken for some other condition as well?
Yeah, again, a very nice question, because every individual has a thyroid report now. And then when the report is normal, the clinician and the patient wonder what the problem is. Now, in this context, the most common problem is obesity. Any individual, when they put on weight, the first thing that is done is they get a thyroid test done. Well, it is a myth to a certain extent that hypothyroidism leads to obesity, and similarly that all obese people have hypothyroidism. No, that is wrong. All obese people don't have hypothyroidism. All hypothyroid people are not obese. So to a certain extent, both are different, but both are very common disorders. So this is very common that obesity, people think they have become hypothyroid. And second thing is, kidney diseases. Because of retention of water, nephrotic syndrome, kidney failure, heart failure, all these conditions, they mimic hypothyroidism. Then certain neurological disorders like, Parkinsonism, because they become immobile, they are lethargic, that is again mimics hypothyroidism. And then in the COVID period, people have used a lot of steroids, corticosteroids were given. So when steroids are given, they develop puffiness. So that puffiness is again mistaken for hypothyroidism. So these are some of the common disorders where hypothyroidism is a great mimicker of so many disorders. So often when the report comes normal, we look at all these other common problems.
Right. Dr. Sahai, is it true that people with hypothyroidism have a higher risk of developing other autoimmune diseases?
Well, I would not agree with that statement. I would say that people with other autoimmune disorders have to be screened for hypothyroidism, but it's not necessary that people with hypothyroidism will have more of autoimmune disorders. So it's not necessary to screen all individuals with hypothyroidism for other autoimmune disorders. While hypothyroidism, the most commonest cause of hypothyroidism is Hashimoto's, which is an autoimmune disease itself, but it coexists with other autoimmune conditions, but by itself probably it doesn't lead to an increase in other autoimmune conditions, and we don't have to really worry so much about screening for all the other autoimmune conditions in people with hypothyroidism. But we need to do the other way around, that is, people who have other autoimmune conditions, we need to screen them for thyroid dysfunction.
Right. Dr. Mithali, now, if there is a myth that a person can't lose weight if he or she has hypothyroidism, is this true?
Well, I agree, this is a myth to a very large extent. This is a myth. See, when somebody has hypothyroidism, it is 100% right that we have to treat them adequately, right? But then many of the people who are obese, when they go for weight reduction therapies, they are often told by their treating people, they tell them you have a thyroid problem, that is why you are not losing weight. That is not true. So both, again, as we have discussed, both are different entities, both are common disorders. Somebody has hypothyroidism, yes, it is mandatory to make them euthyroid. And for weight reduction, they need to do the workup for weight reduction.
All right. Well, now Dr. Ashraf, they're back with us. And Dr. Ashraf, does hypothyroidism weaken the immune system? Can it cause anemia or any vitamin deficiency?
Yeah, hypothyroidism can be associated, as we have already discussed, that it is an autoimmune condition. Most of the time, it can be associated with other autoimmune conditions like pernicious anemia. In that situation, it can lead to vitamin B12 deficiency, where there is anemia is there, and also because patient of hypothyroidism, they are having, you can say, a lack of appetite, malnutrition can be there, and in women it can lead to menstrual irregularity. Therefore, there may be excessive blood flow during menses, which can also lead to anemia. Rather, regarding this autoimmune, this immune dysfunction, that does not happen in patients of autoimmune. Our immune system is not weak in patients of hypothyroidism because they are doing quite well. But many times it can be associated with some of the autoimmune conditions which we have discussed previously.
All right. Well, thank you so much, doctors, for talking about this, and hopefully viewers will find that information very, very helpful and something that one needs to look out for. Thank you all for watching at home. Goodbye.